for those of you, most of you I'm very familiar with, but for those of you who I haven't been able to meet, my name is Anthony Kobe. I'm the Director of Collaboratives and Community Engagement at the Lynn Institute. And for this meeting is comprised of our Healthy Community Collaborative in Northeast Oklahoma City. And for those of you who haven't attended this call or meetings we've had, the Healthy Community Collaborative is a culmination of different leaders, community leaders, organizations, civic leaders, all really focused on engaging and working to build Northeast Oklahoma City. And so whenever the pandemic hit and really required us to rethink congregating, we saw this as an opportunity to continue to pull people together, but also be mindful of the concerns around the spread of coronavirus. And so over the past few months, we've been doing this to keep each other updated on our efforts. And so today we have a handful of fantastic leaders in the community who we're excited to hear about or to hear from that are doing great things. And so I'd love to, if you aren't or haven't been connected with the Lynn Institute or the Healthy Community Collaborative over time, I'd love to chat more after this call, get you connected and see how you can continue to work with us and what we've got going on. But more than anything, this is a way for us to share information and share ideas on how we can continue to move the needle forward and develop initiatives and efforts in Northeast. So like I've said, I'm excited to have you guys on. Steve Petty, would you like to
Sure.
are you on there, Steve?
I'm here. Hi, guys. Can you see me?
Yeah,
Hey, for those who don't know me, I'm Steve Petty. I'm the Executive Vice President. I'd like to thank our team at Lynn for getting this all going. And I'd also like to thank our board members that are attending, Leslie, Lynn, and Elizabeth Dalton. Those are the ones I see. And if I'm missing anyone else, just thank you all and all of our community partners. Just quickly, I want to let you know some of the things that we've got going on. As most of you know, the food distributions that we've been doing in Northeast Oklahoma City have been going fantastic. And thanks to Janine and Anthony and Angela and Steve Haynes and all of you that have been helping. It's amazing. I didn't get to the last one. I hear it was hot, but extremely successful. There will be another one that Janine and Anthony will be putting out here pretty soon. And then we're going through at least August at this point, but we have a feeling that Go Fresh will continue to provide this to us over the next few months. So I'd like to thank everyone for helping with that. The food distributions, again, just one portion. Like to let you know about a lot of things that are happening. Janine has worked on a great program called On the Road to Health that we just got funded for Northeast Oklahoma City. So lots of information coming about that. If you want to, please just side note me or Janine, and we'll talk about it. She's got some other stuff going on. For some reason, she thinks we need money. And we do, especially in this time of COVID, we need it. All of us nonprofits are really struggling, but thanks for all of your help and all the in-kind and then the grants from Ardmore Institute. And then Janine is working on a salsa cell that you love, and she's also working on our second legacy luncheon that you're all going to be hearing about. So lots of stuff going on. You should have also got a survey from our friends at the Center for Nonprofits, and I know DJ Thompson is on. If you guys could fill that out, we really want to hear your opinion about what we're doing. Are there any gaps? And we're going to use all of that information to develop our strategic plan over the next few years. So thank you very much, and I'll turn it back, and we appreciate all of you.
Hey, can I chime in for just a minute?
No, don't let her. Don't let her. Yes, of course.
I just want to make sure everybody knows Inasmuch just also gave us an emergency grant, and we are so thankful for that. I see Alta on, and Alta,
Thank you,
we
Alta.
are very, very appreciative of that.
Thank you all. Anybody has money, please let Janine know.
Oh, the good old Steve Petty. Yeah, so thank you, Steve. Thank you, Janine, for that information. Like I said, a handful of people giving updates at this time. I'd like to, I think I just saw him on, our good friend Greg Jones, who is the Director of Community Engagement at Centennial Health. Are you on with us, Greg?
I am.
Greg, how are you doing this morning?
I'm doing well.
Yeah, well, thank you so much for being on with us.
Well, listen, I wanted to, first of all, again, just thank the Lynn Institute and all the things that are going on, all the volunteers making tremendous headway. And there's a lot of positive momentum within Northeast Oklahoma City. Just in my role at the clinic, Centennial Health, I get a chance to interact with people and patients throughout the day. And a lot of people are beginning to notice there's a different climate while we're in this midst of COVID-19. What I wanted to do today was give you a little quick update on something that's actually happening tomorrow. I've been asked to moderate a diversity panel with OU physicians. They've reached out. We've been in connection with them, and they want to do some diversity, start a discussion, I should say, about diversity within the OU physician realm. So tomorrow, I'm going to moderate a panel. I've got some very esteemed guests. Beverly Glover, who's part of our collaborative, will be on that. Stephen Moore will be a part of that panel. Lee Rowland will be a part of that panel, as well as Kaylee Dotson over at Restore OKC. So again, we are in the midst of an opportunity to start a conversation with OU. Some of you might and might not be aware, but there's a long history with OU and the Northeast Oklahoma City community that hasn't been very good. So this is a great, very positive thing that's about to happen, to start a conversation about diversity. So we'll spend about an hour talking to them tomorrow, asking some questions, allowing our panelists to respond, and to really start a dialogue with them that we hope will not be obviously the last time that we have a discussion together. So we're excited about that. And obviously the next time that we get together, we love to report back on how that went.
Thank you so much, Greg. Does anybody have any questions surrounding what Greg's comments?
Who are those panelists again, Greg? Lee Rowland and Stephen Moore. Who else will be joining you?
Kaylee Dotson and our very own beloved Beverly Glover.
Thank you.
Thank you so much, Greg. We are incredibly appreciative of you taking time to be with us today, as well as being on the call tomorrow. That event or discussion rather will be recorded, and so we'll be looking at how we could get that information and that video out to our partners. And so it will be internal with the organization, so it won't be streamed directly as the event's happening, but it will be recorded, and we'll look at ways that we could get the information out. And so thank you so much, Greg. Miss LT Knighten, are you on the line with us?
Hi, I'm here. How are you?
I'm doing well. For those of you who don't know this rock star, LT Knighten is the Government Affairs Liaison for the Oklahoma City County Health Department. And this incredible woman has been providing us with updates as to how the pandemic is progressing and transforming the way that we're living in our community. So LT, thank you so much for being on with us today. And I've been looking forward to hearing this update.
Sure. Well, we just appreciate you all for the work that you all are doing. And I think you are probably one of the nonprofits that we see the most having these regular updates with your stakeholders. And so we just appreciate it. I know it's not easy, Janine, Steve, and Anthony, but I think it's important to kind of keep things going, keep the information out there. We know that there are so many other, all of the comorbidities, all of the ACEs, all of those things that were there before COVID are still going to be there after, we're finished with this pandemic. And so I think it's critical that you continue doing the work that you're doing, trying to meet the needs of the citizens in Northeast Oklahoma City. So thanks for always inviting me to give what I hope I'll try to make it quick, but just cut me off, Anthony, because I get excited about this topic and I'll overshare and then I'll run out of time. But just to give you a quick update on where we are, Anthony talked about the virus, transforming our community. The virus and our response to the virus has definitely transformed just even in the past 8 weeks or so. As you all know, we are in a much different situation today than we were back in March when the virus was surging in some of the larger cities in the eastern section of the United States. We are now one of those hotspot communities. Multiple states around the country have put travel restrictions on Oklahoma, where they either don't want their citizens traveling to Oklahoma, or if someone from Oklahoma is traveling to their community, that person has to quarantine for 14 days. So we are not in a situation that any of us wanted to be, but we are here. And so I hope today to talk a little bit about what we're doing to combat the further spread of the virus. Just to start off with a couple of stats, in Oklahoma County, we have had 4,986 confirmed cases since the beginning of this pandemic in March, and we're at 74 deaths. In the state of Oklahoma, 20,745 cases and 424 deaths. In our country, 3,323,432 cases and 135,272 deaths. These are our numbers from just yesterday, July 13th. Quickly to talk a little bit about what we're seeing specifically here in Oklahoma County. Our daily new death rate still remains low. We have not recorded a death in Oklahoma County since July 8th. And then prior to that, it was July 5th. And then prior to July 5th, you have to go way back into early June for when our recorded death, the last death was recorded in June. And so that's causing a little bit of confusion, as you can imagine, with the public. They continue to hear that cases are rising, that the situation is not positive here in Oklahoma. But then that message gets confusing when we don't hear about a lot of deaths occurring. That's something that we definitely know is resulting in how the virus is impacting Oklahomans right now. It is primarily impacting those individuals who are age 18 to 49, so a different demographic than when this pandemic first hit back in March, where it was, of course, impacting our senior citizens, those 65 years of age and older. And so while the virus is definitely picking up speed, transmission is occurring in a much broader fashion than it was back in March. It's occurring in that younger demographic. They're at work, they're going to restaurants, they're going to neighbors' homes, they're going to parties, and so the virus is spreading at a much more rapid pace. However, those individuals are not getting as sick as the senior citizens who were primarily impacted back in March. That does not mean, though, that this is a good thing. We know and we are expecting that we're going to start seeing our older demographic be impacted by what's happening with the younger demographics, particularly since we are reopened. And so that's why it's more critical than ever for those who are 65 and older to continue only going out for essentials as much as they can. We know that that's not possible for every individual over 65. We know that we have members of our community who are over 65 that are still working full-time, whether it be at an essential job like a grocery store, or they're working in transit, or wherever they're working. We know that that's not the case for many of our community, particularly in Northeast Oklahoma City. And so because of that and a myriad of other reasons, at the health department, we are continuing to stress mask wearing. We know that that masks are currently proven to be one of those tools where we can prevent or lessen the impact or the potential that someone can catch COVID from someone else that they're in the same space with. So with that, we have started to really ramp up our messaging, not just around masks, but also being transparent with the public about where we are seeing the virus spread the most here in our community. So hopefully you by now have viewed our Serious 7 or Serious 5, depending upon the week, the number changes. But this week we're looking at a Serious 5, and this is a group of 5 locations where our epidemiologists, based upon our contact tracing investigations, are hearing from positive cases where they've been, and it helps us drill down and pull out data to show these are the places where a lot of our positive cases have been recently. So restaurants continues to be a problem. Intimate gatherings. This is something that, if you remember in the early part of the pandemic, a lot of the conversation nationally was around large group gatherings. You know, we canceled everything that was considered a large group gathering. But what we're seeing here is that it's really those small, intimate gatherings, dinner at someone's house, weddings, funerals. We're seeing quite a bit of outbreaks, believe it or not, at weddings and funerals. Tulsa had some significant, 2 or 3 significant outbreaks that were traced directly back to 2 large funerals that were held back in June. Faith-based venues. I want to take this opportunity to be very transparent with you all because we need help in spreading this message. We've kind of gotten a lot of negative responses and comments from the community whenever we put out messaging about what we're seeing in churches and other faith-based venues. We are seeing the virus spread in those venues. I mean, it's not something that we want to hide. It's not something that we don't want to share. We're not, deliberately trying to offend our faith-based community, but it is a fact that we are seeing in churches that are still meeting, particularly churches where choirs are singing, we are seeing outbreaks across some of those facilities. And so we want to give faith-based organizations the tools they need to keep their congregants safe. And so I'll tell you a little bit about what we're doing there in a minute. Bars, that's a given. And I'll be happy to say this on the call. We our public health anyway, we definitely would like to see bars not be open, that's something that's not in our control. Obviously, that's something that the city council or the mayor would have to do, but bars, obviously loud music, people are drinking, they are not social distancing, and they're not wearing their masks. And then finally, gyms and athletic events, particularly indoor activities like indoor basketball, any indoor activity where people are breathing heavily and it's too warm for them to obviously have a mask on, we're seeing the virus spread. We've had a couple of outbreaks at youth basketball leagues in particular. So those are the 5 areas, again, that we've seen significant spread just here in the past week and a half or so. So what are we doing to try to help mitigate that? One, we're working with churches, providing them with tools that they can use to help protect their congregants. We are also working to put masks out in the community. We're so appreciative of the Lynn Institute. Steve, I don't recall the exact number, but I know that you all have received a couple of thousand masks from our agency to hand out to your partners. And so we appreciate the Lynn Institute for doing that, and keep it coming. We still have plenty of boxes to give to you if you need more. 2 last things I want to touch on. We are also keeping extremely busy this month working with the school districts. As you all know, there's a lot of controversy around whether schools should open, if they do open, whether students should be masked. Our goal right now is to help work with the schools to help them identify ways that they can properly social distance the students, but then also we are putting plans in place to handle large outbreaks that are likely to occur in the event our schools reopen as normal. So that's what we're focused on this week. And then finally, we are meeting, of course, as you know, with Mayor Holt and the City Council this Thursday. We are going to provide them with a much deeper dive into the data that I told you about earlier. We're going to look at hospitalizations here in Oklahoma County, and hopefully give them the tools they need to start thinking about what long-term solutions, whether it be city ordinances, whatever it is, what long-term solutions can the city start putting into place to help get these virus numbers back down to where they were just 2 months ago. So please join into that meeting. I believe it begins 8:30 a.m. on Thursday, and it'll be carried on our social media channels as well as the city councils. So with that, Anthony, I'm happy to take questions over the chat or live, but I appreciate again the opportunity to update you all.
Oh, can you guys hear me? Okay, there we go. Thank you so much, LT. One question that we did have was regarding information people have been getting on Facebook regarding the limiting the spread and what you can do. And so people have been seeing a lot of things like drinking certain types of drinks or showering when you get home. What advice would you have for people who are looking for information regarding how they can limit the spread, generally speaking? Oh, I think we're muted.
There's so much out there on social media. I think it can be overwhelming because everyone is what we call an armchair epidemiologist, right? And so what I would say is make sure that you're getting your information from credible sources. You know, follow Oklahoma City County Health Department on Twitter and Facebook. We are only putting out there the proven information that has been proven by research. It is agreed upon by the CDC, National Institutes of Health, World Health Organization. I know that they've become, you know, it's kind of become political with who, and you have camps that don't believe who or you know, do believe who. Regardless, as public health, again, we will put out information that is vetted, and I want to just remind everyone that, you know, there is no magic cure right now, right? So if you hear about prescription drugs and all of these things, yes, the FDA has identified some pharmaceuticals that are helping individuals who are hospitalized, but it's not a cure. We don't have a vaccine, and so the best things that we know right now that work are masks and social distancing. And so those are really the two things, you know. Yes, if you're out in a crowd and, you know, you get home, of course, you know, you want to, you know, shower, whatever it is that you need to do to feel like you're, you know, getting those germs off of your body. But when you're out, the most important thing is making sure that your face is covered. One thing that, you know, we haven't put this out in public yet, but we do know that there are studies that show that the virus can enter through your eyes, just as with any respiratory illness, right? If someone sneezes. And so, you know, if you're in a situation, you know, you have to go to the doctor's office or something, and you're going to be really close to someone, you know, you may wear a pair of glasses or sunglasses or something. That's the only other tidbit I would say to think about. But definitely your mask. And not getting close to people, particularly people who are not in your household.
Yeah, thank you, LT. Another question we have, and this is from our good friend Nancy Hall. Do we have sufficient numbers of contact tracers in Oklahoma County?
Sure, great question, Nancy. So right now we do this week. We have about 125 people working full time as contact tracers. That's just here at Oklahoma City County Health Department. The State Department of Health, they have leased space over at the old Lucent Technology Building. For those of you that are familiar with that building off of Reno, I believe that they have upwards of 300 or more currently working, and are recruiting more every day. And so, yes, right now we're doing well as far as contact tracing. The one thing that I did not mention in my discussion with you all, that I'm sure you're hearing about in the community, and you yourself may have experienced this. The one problem that we have right now is around the test results and the timing that it takes to get the results back. It's not a problem that's unique to Oklahoma County or even Oklahoma. This is something that nationally our country has not been able to figure this out the way that other countries have. Our labs are overwhelmed. I just heard from our COO the other day that, for instance, one of the labs here in Oklahoma, they have students who are bloodborne pathogen, work with bloodborne pathogens. They're working at the labs this summer, but once school starts back, those students are likely going to be going back to school full time. And so there's a lack of even professionals who are experienced in working with bloodborne pathogens. And so that's only going to add to the delays that we're seeing in both the public and the private labs. And so contact tracing is important, obviously, but if we're having to wait 5 to 7 days for someone's result to come back, it really doesn't help if we have enough contact tracers. If that person is still out and about, going to work, doing whatever they do, while they're waiting on a test result, particularly if they're asymptomatic. And so I just wanted to be transparent with you all that that's a major issue, that until we can solve the test turnaround time, we're not really going to be able to really have an impact with contact tracing the way we would if someone could, if they were notified that they're positive immediately. We, of course, have rapid tests out there that are being performed by some of the private providers, particularly urgent cares. I will tell you, the rapid tests, they are still providing a good percentage of false negatives. And so we always encourage everyone, even if they get a rapid test, that they need to follow up with a PCR test. And that's the nasal swab that the health department provides, and then also Walmart and CVS. And then your FQHCs like Perry Clausen and Variety Care also provide the PCRs. The PCRs are they provide the highest accuracy in determining whether or not a person has an active infection. So I wanted to be transparent with you all with that. I know that that's a major concern in the community, and we have not been able to come up with a solution at this time.
Another question. Oh, Janine, did you want to add something? Oh, right there.
I can. I was just going to put in the chat, Lynn's for-profit arm company has a COVID-19 vaccine study that's starting in late July. And it's part of the effort nationwide to find a vaccine for COVID-19, hopefully as soon as possible by late 2019 or early 2020. That's the hope. We're not sure that will happen, but that's the hope. So we're very excited for our for-profit company that this prestigious study is going on right here in Oklahoma City and also in Colorado Springs right now.
And you all are recruiting participants for that study as well, right?
We have been recruiting.
Yeah.
And surprisingly, we have had a huge response. We weren't sure what kind of response we would get on people wanting to participate, but it's been overwhelming. And so we're excited to get that started and to be part of the solution to eliminate this, or at least prevent this virus. So.
Yeah, one last question that we had for you, LT, is other than masks, what other supplies or assistance are you providing for schools, and what are you hearing from the faculties as most needed?
Yeah, great question. So the schools haven't actually asked us for anything, whether it be supplies, PPE, or mask or anything. We certainly have those materials available to give the schools. Most of the schools are receiving funding through the state's CARES dollars, and so it appears as though the schools are doing okay as far as PPE goes. The primary thing that they're looking for is just guidance in their reopening plans. As you can imagine, a lot of them are concerned about, particularly the lower grades, who the CDC says masks are okay for kids over 2 years old, but those of you who have kids, you know that those elementary school kids are not going to keep those masks on all day long. And so the schools are really focusing on how do we properly social distance our students. And so we're helping them with that guidance. You know, they want to know, is it okay to go ahead and start football practice? And is it okay to do choir and all of these things? And so that's primarily what they're looking for. And then of course, the other piece of it is, what do I do if I have an outbreak in a classroom? What happens? And so we are actually dedicating a full program here at the health department. It's our Health at School program. Some of you might be familiar with those folks. They are going to be our contact tracers and investigators, specifically working in school populations. And so we have some other things going. We've requested through the city CARES dollars. We've put out some budget proposals to buy some tabletop lab machines that might help us actually go into the schools and do testing that way. There are some saliva tests that are currently awaiting FDA approval. We're hopeful that those will be approved by the time school starts, because it'll be a lot easier to do saliva tests with students, you know, the cheek swabs versus the nasal swabs. So there's a lot of things working, but primarily it's around guidance. And then how are we going to get these students tested when we have outbreaks?
Yeah, thank you so much, LT. And I know this may throw things up just a bit, but I think it would perfectly segues into the conversation we're having. I see we have Superintendent McDaniel on the phone. How are you doing today?
I am great. LT, did I hear you say that it would be impossible to keep a mask on a 4-year-old? Is that what I heard? Are you kidding me? Holy cow.
Yeah.
Oh, that's good. Well, Superintendent, thank you so much for being on with us today. We're thankful for you taking time to be a part, and really we'd love to get an update as to the work you've been doing and how this process is going, and what you guys are really looking at in terms of the upcoming calendar year.
Sure. Thanks for having me. I appreciate it. And just since I get to follow LT, I just want to say how much we have appreciated Oklahoma City County Health and LT and her team, and just an incredible support for us. And she's right. We're looking to them for guidance. They've been a part of our teams as we meet, our task force, and then we've been a part of their team as well, just as we're trying to figure out our best route to reopen our schools. So we had a board meeting last night. Back in June, we released our initial back to school plan, which really gave parents and families and guardians 2 options. One was a 100% virtual option, and one was a 5-day-a-week come back to school option. And we knew that as things changed, as our circumstances changed, we would have to be flexible. And lo and behold, over the next 2 or 3 weeks, our circumstances changed. We saw numbers begin going up, whether it was case numbers, hospitalizations, etc. So as we followed that, in our board meeting last night, we presented our board with some considerations to adapt our plan. So one recommendation was that we require, rather than recommend, we require 5th graders through 12th graders to wear face coverings. That was a recommendation to add to our plan. We knew that to mandate a pre-K through a 4th grader, we're talking about 4-year-olds through 9-year-olds basically, to mandate wearing a mask would cause some concern. So what we said was, and this is really semantics, we said that we were going to expect it with our assistance. So different than mandate, it's a rule. There may be a consequence if you don't follow the rule. We said we're going to expect it of pre-K through fourth graders with our assistance. So we have the opportunity to teach kids the importance of wearing a face covering. We can demonstrate and model. If a 4-year-old takes his mask off 5 times in the first 30 minutes of school, it does not become punitive. It's a teaching opportunity for our little ones. So that was a recommendation. Face coverings, mandatory, 5th grade through 12th grade, expected with assistance, pre-K through 4. Then we gave our board 2 considerations, something to think about between now and the next couple of weeks, at which time we will actually present a final plan to the board for their approval. So our 2 considerations were, number 1, that we move away from a 5-day-a-week brick and mortar in-person option, and that we move to what we call a contingency plan, which is 2 days on and 3 days off. So we divide our kids into 2 groups. And on Monday and Tuesday, group 1 comes to school. And in doing it this way, we're able to socially distance. We have, instead of 27 kids in a class, we probably have 12 kids in a class. We can social distance on a bus. We can social distance in a classroom. We can social distance in a lunch line. And so group 1 comes Monday, Tuesday, while group B on Monday, Tuesday, they are learning virtually. And then on 2 other days, we haven't decided when, if it's a Wednesday, Thursday, or a Thursday, Friday, we would flip that. So group B would come to school and group A would learn virtually. And so in doing this, we're able to accomplish a couple things. 1, we believe it is critical that we get our kids back to school. But we don't think that our data and our conditions allow for 5 days, because if you come 5 days, that means you are kids to a seat on a bus. That means you have no way to socially distance in a classroom. And we think we're putting kids in harm's way if we take that approach, even with masks on. And so our consideration was, let's cut our kids in half and go an A-B model. And so the other consideration was, we have identified August 10th as our first day of school. And we gave our board as a consideration moving that date further into August. It gives us opportunity to work with our teachers as we tighten up our virtual learning process. And so it also gives our parents and guardians and our keepers of kids an opportunity to better prepare for this type of a schedule. Childcare, work with my employer on what this might look like for my schedule. So those were the 2 considerations, and then the recommendation we had. We're working around the clock, again, with our public health officials. We are collaborating with school districts all over the country. We don't want to feel like we have to reinvent the wheel here. Although Oklahoma City is unique. There is not another district like ours. There are similarities with other urban districts, but every urban district, every district has a uniqueness. And so we want to make sure we are doing right by our kids and our community. And so you can look for a final recommendation within the next 2 weeks to our board, and they will take action on that recommendation. So I'll take a deep breath. That was a lot, and would be happy to answer any questions that you have or provide clarification.
A question we have, thank you so much for that. But our question we have from Leake is, how would this reflect kids participating in sports?
Great question. We have very specific guidelines from 2 different groups. One is our CDC on how to approach a return to athletics and other activities like band, speech and debate, drama, etc. So CDC gives us guidelines, but we also have a national federation of athletics and activities that we rely on for guidance. Right now, we have brought kids back all over the state in a phased-in approach. So right now in Oklahoma City, we have kids reporting to weight rooms. They observe social distancing, they wear masks, they follow all the precautions that are put in place. We believe we've got to do a really good job of being consistent with our message. It makes no sense to say we're going to shut down academics, but hey, if you're a football player or a softball player or a band kid, come on, we'll take you. So we got to be consistent with our message, but we also have to be practical with this. If we follow guidelines, we can provide safe zones for athletes, band kids, speech and debate kids. If we see that we're compromising safety in any way, we will be very quick to shut things down. And I know that will cause World War III in Oklahoma. If we take football away, holy cow, look out. But we believe very strongly as a Board of Education and as a staff, and our coaches are on board. Our athletic director is on board. If we see that this compromises the safety of our kids in any way, we will shut things down.
Thank you so much, Superintendent McDaniel. Does anybody have any other questions? I know that I'm sure that you guys have had a ton going on, and so we are incredibly thankful for you and your team and the board having these conversations, really all geared towards making sure that our children and families are put in the absolute safest environments. So thank you so much for taking time to be with us today. I greatly appreciate it.
Well, it's good to see you all. Stay safe. Great things going on in Oklahoma City Public Schools. Stick around and watch. Great things going on. We've got great people. So thanks again. Good to see you, Anthony. And the rest of you, I'll talk to you soon.
Likewise. Thank you, sir.
Yeah.
Another partner who we have to give an update with us is while he's new to the organization, he is his organization has been a longtime advocate and partner of the Lynn Institute. Just saw you on there.
I am, Anthony. I appreciate the setup. There's JT, there's Sean, and then the new guy. So I appreciate just letting me just jump in the pool without water, and here he is. I don't know what to even say or how to start after those two conversations, but great information by both of them, and thankful for the work they're continuing to do. And like Sean said, that's exactly what we're doing. We're listening to those in the no. I'm not even going to try to be a right arm whatever. I'm not even going to try to do that or pretend like I have the skills to do that. But we appreciate the information coming as quickly as it is from the county and from the state. Our district emergency response team is is getting together 3 times a week to be able to analyze the information as it comes our way. I think we're in a situation where we're really, 3 things that I keep saying that we need to continue to do, and not necessarily in this order, but maybe it is, and that is, number 1, keep clean. We need to be washing our hands, understanding what the situation in life that we're in right now. Keep calm when information is given to us, and then keep safe and make sure that all those around us are safe. I think the other thing is that we need to keep in mind is don't allow the pandemic to control us. And let me explain. I'm so grateful to the Lynn Institute and grateful in doing this food drive. And so continuing to meet the needs of our community, nutritionally, career opportunities, education, cannot stop because we're in a pandemic. It can't. And I appreciate the Lynn Institute saying, hey, we can do the food drive and we can do it safely and here's what we're going to be able to do that. Anthony, to say it was a hot, I would say, is a huge understatement. I mean, I've never been to Hades before, but I don't want to go if it was anything like that afternoon. But it was so much fun, and getting to meet people and to see the community come in with faces that have smiles on them and the gratitude that they had. We had Westmore Wrestling Team there, Anthony. And that's the other thing in this pandemic. You can look and see, here's opportunity, or you can be scared and just stop doing what you're doing. And I appreciate it. Go ahead, Anthony.
Oh, no, I was just going to chime in and ask you, so since you've been at Metro Tech, it's been a few months, correct?
Few days. I think I'm on day 12, but who's counting?
Right. And so now, since you've been here, could you inform the collaborative where you're coming from?
Yeah. So I was previously in Fulton County, Kentucky, West Kentucky on the Mississippi River, and I was there as superintendent for 7 years. And I have been married for over 20 years to my wonderful wife, Chanel. We have 4 children, and 2 boys and 2 girls in that order. Caleb, Daniel, Lydia, and Abigail. Since you asked, there's my picture of the family. And so graduated from Oklahoma Christian University in 1999. So familiar with Oklahoma and the area, and so glad to be back. And Anthony, I was just going to say too about the Westmore Wrestling, YMCA, Rotary. Thanks for bringing us all together. I think it's so important that we're able to see, like Westmore Wrestling Team there, community is so important. And it's so important to teach each other the importance of not only community, but to give back. And so teaching those young people at an early age the importance to give back, and appreciate Lynn Institute giving back.
Yeah, you're right. Aaron, it was a great opportunity, and we're just excited to continue to establish our relationship and partner with Metro Tech. Some of the strongest allies we've had have been with Metro Tech through our partners and board member like Valerie McMurray and Gerald Scott, and so many people like that have been so ready to put the time in and the work in to making change and positive impacts in Northeast. So we are incredibly thankful for you being a part of the food distribution, and to see what comes from it. A question I do have regarding Metro Tech, what are some exciting things coming up? Maybe some new programs or things of that nature that you guys might have as opportunities?
Yeah, that's a great question. I think we're continuing to look at spreading the great news of all the different programs that we have. We have so many things to offer. So I think that's where we're at right now, and to get that information out there and understand that Metro Tech is a holistic approach. So Anthony, if I could have like 1 minute to explain that, if I may.
Yeah, please.
So what we're looking at is that go to the elementary schools, tell people about Metro Tech, tell about the careers that are here in Oklahoma City area, have elementary students come and visit our 4 campuses throughout the area, them being able to see what we do, what goes on, again, what are the careers and the opportunities that they have, and that they are here, right here in their backyard. They don't have to go anywhere. They can stay here in Northeast Oklahoma and have a great life and enjoy their family and a great place to live. And then through grades 6 through 8 in middle school, having career exploration so they can explore different various careers that are here locally, and then get some momentum there. And then high school say, yeah, you remember that career exploration and said that your skill set would match these careers? Here's the careers we offer here at Metro Tech and the learning that you can attain. And so they receive that certificate then in high school, and then we place them. Our goal is to have 100% placement for jobs. And so they get in a career and they go, oh, crap, this isn't really exactly what I wanted to do. Where can I maybe have some a career change? Where can I go? Oh, Metro Tech. yeah, they can help me and figure out my next career. Or they get a career and they're a foreman at manufacturing or an entrepreneur and own their own business. They're thinking, man, who can I go to that could provide my company some training? Oh, Metro Tech. And so we have this holistic approach that Metro Tech then provides for career throughout their life.
Yeah. Aaron, thank you so much. I greatly appreciate you taking the time today to be on. Like I've said, we're excited to continue to work with you and the amazing staff that's at Metro Tech and people who really are genuinely sold on the efforts of your organization and making a positive impact. So with that, thank you so much.
Thank you, Anthony, and thank you, Valerie, and to there's several of our team members on here at this time, and appreciate the work that they're doing. Appreciate the camaraderie that we have. Appreciate Lynn Institute even inviting us. You said to allow you guys to come on campus. Come anytime. We are elated about this opportunity and about providing what our community needs, and everyone here today is a part of that. And thank you so much for everyone's heart, and we're going to make Northeast Oklahoma better.
Thanks again, Aaron.
Thank you.
Our last updater of today is a fantastic woman. She's here speaking on behalf of Miss Commissioner Carrie Blumert. Lou, are you on with us?
I am here. How are you, Anthony?
I am doing so well. Thank you so much for being on with us today.
Good. Thank you. Well, first and foremost, Commissioner Carrie Blumert is on a very much needed vacation. So, but she did want to send a couple of updates for everyone. The first one is the Jail Trust. The Jail Trust Authority officially took over operations of the county jail July 1st. The sheriff and his new law enforcement staff moved to the Krause building, which, if you're not familiar with it, is located on Northeast 36 in MLK. The sheriff will no longer have authority over the jail. Okay, so the new administrator of the jail is Greg Williams. He is so excited and ready for changes inside of the jail and to make the facility more humane and more supportive of the detainees. So his background includes social work, corrections, and administration. So day one, he already made changes. He made a change to the food contract, which the detainees have really raved about how delicious the food is compared to how it was previously. He is also purchasing tablets for the detainees to access programs, classes, and also video calls, which is very important. And the second update is the County CARES Fund, which many of you probably already know. Oklahoma County received $47 million in CARES Fund to respond to COVID-19. District 1 has been very hard at work looking at ways to support the community with this money, and also keeping in mind of the deadline of December 2020 to spend these county funds. Our district attorney has issued several opinions on how we can spend this money. These opinions are very strict. They have a very strict interpretation of how these money should be spent, and it's making it slightly difficult and a little frustrating. But our top priority areas for District 1 includes eviction protection, small business support, also to help OCCHD, which they've been doing a phenomenal job. We want to be able to support them as well. PPE for the county courthouse, including the jail and also the juvenile center, and also a few county needs that we have internally. So those are the two updates for Oklahoma County. Uh-oh.
You know, I did that thing where I mute myself right before. Yeah, thank you so much, Lou. Thank you for being on.
You're
Um,
welcome.
Next time you talk to Commissioner Blumert, you let her know that we hope she enjoyed her time. We know that she's a dedicated public servant. We're so incredibly thankful for the efforts both she and you are attending or attempting to make in this community. So we're incredibly thankful for that. Does anybody have any questions for Lou? And if in the case that you do, and maybe I missed it,
Hey,
or
Lou, you know that the Lynn Institute and our partners could really, really help you. We have a list and we would love to give it to you and Carrie because I really feel like this group knows how to spend money wisely. So please
Yes.
keep that in mind.
You know what? And I'm going to put this in the chat for everyone. I'm going to put my email address. Seriously, if there's anyone in the group that has a need, please send us an email. I'm going to put my email in the chat because we do want to hear from everyone. So
oh, you're going to hear now. You're going to hear.
No
Thank you very much.
Thank you.
Lou, thank you so much. And to everyone, if you have questions, maybe from someone else who gave an update, if you get me that question, I'll connect the dots. I can get your question answered, or I can connect you to that person. We're so thankful for all of you being on the call. We genuinely believe that collaborative efforts make such a greater impact in both delivering service, making impacts, but also limiting duplication of efforts. We all want to work in the same direction together and not try to pull resources from different things that can be worked collectively. So thank every single one of you so much. Oh, Carrie, how are you?
Oh, I am doing just great. I didn't mean to interrupt you, but I have a couple of announcements that I would like to make. That's going to be things that's going to be happening this week, if I may.
Yeah, I would love for you to give your updates or your yeah, go ahead.
Well, good morning, everyone. I'm Carrie Smith, and I'm at Community Health Centers of Oklahoma. You all know us by Mary Mahoney Community Health Center, and Commissioner McDaniel, Superintendent McDaniel, was talking about the sports. And so CHCI will be offering free sports physicals starting Thursday, July the 16th. This will be at 5:30, and this will be at the SAS Northeast Oklahoma City. Also, we will be conducting free sports physicals, and this will be at Star Spencer High School. Also, we're still doing our COVID-19 at PK from 9 a.m. until 11 a.m. This will be on Tuesdays and Thursdays. And we will be doing the HIV awareness. This will be July the 25th at 9119 Northeast 23rd Street. And all of these testings is free. So if you know of anyone that need HIV testing, COVID testing, or physical, tell them about community health centers. Thank you.
Thank you so much, Carrie, for that information. And so to that, I would say it's been great to work with our partners, Metro Tech, and organizations like Land Information Services and the YMCA to deliver the food at these food distributions. And you can see Steve Petty added to the chat. Over 147,000 pounds of food have been distributed since March when coronavirus had started. And so we're incredibly thankful for your efforts, because what is true is that if it weren't for them, we would not have been able to do these distributions on our own. And so we'll continue to keep you in the loop and ask you if you have time or know anyone who would like to serve. But when I tell you, the feedback we've been getting has just been incredible about the families who've been able to benefit from these resources. We're so thankful for the time that you're putting into serving and assisting the Northeast Oklahoma City community and the Oklahoma City community in general. And so thank you all so much. If there's any need in any way, please reach out to me. I will gladly try to connect you with resources. And we will be putting together a list of notes from this conversation to get out to you. So if there's anything maybe that you thought you may have missed, there will be a recording as well as notes from this. Does anybody else have any thoughts or questions as we wrap up?
Anthony, it's LT. I failed to mention that we are, because of COVID and due to our clinics being closed so that we could do more significant COVID testing, we have not been doing the number of childhood immunization visits that we would typically do during this time of year, which is our busiest time of year for the clinics traditionally when we're not in the middle of a pandemic. So I included our expanded immunization hours in the chat room. Please, please, please share those with your stakeholders. We definitely want to make sure that regardless of what the school year looks like, kids are getting in for those routine IMs.
Thank you so much, LT. And once again, to all of you, thank you so much for being on the call. And please don't hesitate to reach out if I can be of any help in your efforts. So you guys stay safe, stay corona free, and continue to push forward in your work.